This is John, a male in his mid-20s. He has been with his current girlfriend Jessica for about over a year now. They have had sexual intercourse a number of times, but every time, John has been unable to achieve orgasm. John is feeling a little insecure about his body and his abrupt inability to achieve orgasm. This was not a problem for John in his past relationships, and he does not know what the sudden cause of this is. He seeks out a doctor to explain what is going on with his body and what he should do. He meets with Dr. Ingram and he explains the situation. Dr. Ingram tells him, "John, you seem to have a case of male orgasmic disorder, which is the inability to achieve orgasm despite long sexual contact or intercourse with your partner. A normal orgasm is usually followed by a period of resolution, which includes feelings of muscular relaxation and euphoria, and is usually achieved through sexual intercourse or sexual contact over a period of time. This period can vary from person to person. Of course, there may be abnormalities in this process which can be considered primary or secondary. Primary abnormalities usually last the span of a person's lifetime, whereas secondary abnormality occurs after having normal orgasmic function at one point in their life. Studies show that orgasm usually has more to do with your brain than with your body, so the cause may be psychological. You can conduct a further investigation of a deeper cause of this and look for signs of substance abuse, diseases of the brain, nervous system, or penis. But more common intrinsic factors are depression, guilt, anger, fear, and anxiety. Common extrinsic causes may also include stress, unsatisfactory relationship, and a past history of traumatic sexual encounters. In your case, John, you have a secondary abnormality and may be treated with psychotherapy, which focuses on improving the psychological as well as the physical aspects of the problem with the partner. This is Ryan. He is an 18-year-old male that just got his first girlfriend a couple months ago. Most of his recent sexual interactions with his girlfriend fell short of his expectations, and as a result, he felt embarrassed. He has heard from his friends that they last a very long time in bed, which makes him curious as to why he does not last as long as them. He comes and talks to his father about his problem, as he has done research on sexual topics such as this. His father says, "You may be experiencing something called premature ejaculation, which is common in many new sexually active individuals such as yourself. Premature ejaculation is a recurring discharge of semen with minimal sexual stimulation shortly on or after penetration, earlier than he expects it. Orgasm and ejaculation are two separate events, so you should not confuse those two. Usually the problem with those with premature ejaculation has to do with their sexual history. Another reason may be the female partner's genital size or structure, which may be a contributing factor. To help alleviate symptoms, you can perform certain behavioral techniques such as the stop and start technique or even the squeeze technique. The stop and start technique is where the man continues sexual stimulation until he is about to ejaculate, then is stopped for about 30 seconds, then sexual stimulation is then resumed. This is a cycle that can be repeated until ejaculation is desired by both partners. The squeeze technique is performed when the man is about to ejaculate. At this time, stimulation stops and the patient or partner gently squeezes the ends of the penis at the junction of the glans penis, which is the tip. The squeezing is held for several seconds and sexual stimulation is resumed." This is Joseph. He is in his 30s and has been diagnosed with retrograde ejaculation. He wants to start a family, but his condition has been preventing him from making a baby. He decides to go to a doctor in order to find out more about his condition and what his options are. He schedules an appointment with his doctor and he goes in to see him. The doctor explains his condition and his future options to start a family. He says, "Retrograde ejaculation occurs when the bladder neck does not close off properly during orgasm, so that the semen spurts backward into the bladder. You are still able to get an erection and achieve normal orgasm, but as a result, you may ejaculate very little to no semen at all. Your urine may be cloudy after orgasm because it contains semen, but this is not harmful, but can certainly cause male infertility. Several causes can be due to previous surgery such as bladder neck surgery, retroperitoneal lymph node dissection, as well as side effects of certain medications and nerve damage. If your retrograde ejaculation was caused by nerve damage, certain medications can be used to treat the condition. However, with your condition, since it was caused by past surgeries, we can recommend you to a fertility specialist where they may collect sperm from your urine and use wash sperm for an assisted fertilization procedure.